May 7th is International Harm Reduction Day, and through this week-long Lunch and Learn webinar series, we hope to provide education, direction, and resources on best harm reduction practices and supports here in Central Alberta, as well as greater insight onto how we support healthier, safer communities for all. This is our third Lunch and Learn in the series, and today we're discussing opioid poisoning and prevention. This webinar will be roughly 20 to 25 minutes long, followed by a question period. So please feel free to ask your questions in the Q&A box throughout the presentation, and our presenters will try and answer them at the end. Okay, without further ado, let me introduce today's presenters. We've got Tricia Pidden, our registered nurse working within our overdose prevention program, and Kevin Cunningham, our health promotion and rural outreach worker.
Good morning.
Good morning. Thank you, Mitch.
Morning. Yeah, no worries.
There we go. Okay, so at the top of this slide, you can see our vision here at Turning Point, which is respect and dignity for all in a safe and healthy community. So I'll run down our programs and services and give you a brief overview of which each of them are. And starting out with harm reduction program, which is our largest program, with over 2,000 people, unique individuals accessing those services. These are people from all walks of life. And just on the tip of harm reduction, I'll mention something that Dr. Carl Hart put out, that 70% of substance use is non-problematic or doesn't meet the DSM-5 criteria for substance use disorder. So it's important to remember that not everybody who comes into access harm reduction supplies is experiencing addiction or substance use disorder. So our harm reduction program is access to needles, syringes. We've had people come access needles for steroids, for their pets' diabetes, and for injection drug use as well. We also provide sterile pipes, hygiene supplies, first aid supplies, food, clothing, a whole wide array, and safer sex supplies we also offer out of our office and through the mail too. There was a recent post of somebody who came into access supplies who doesn't usually typically stop by Turning Point, but this person had nowhere else to turn to for a certain supplies they were after. And in the 3 minutes that they stopped by, they were helped out by our front end staff. They witnessed somebody get a new pair of shoes. They also saw somebody get some lunch. So our front end harm reduction staff do so much for people. They help with faxing forms, doing copies, making phone calls. We just try and fill whatever gaps we can at the front end. Next program I'll mention is our women's program, and that was inspired by the Her Pregnancy program at Streetworks in Edmonton, which stands for Healthy, Empowered, Resilient. And our nurse and outreach worker work with street-involved women and girls. They help address substance use, poverty, domestic violence, and the focus is on sexual and reproductive health. And I can't say enough about the women's program. I have so much respect for what they do in there. And we're hiring. So at the moment we're hiring, so please send resumes through to the website or look for more information on our website. I think the posting is on Indeed. Our rural outreach program, since Turning Point is the harm reduction agency for all of Central Alberta, which is a population of around 450,000 people. Our rural outreach workers, which is myself and Jen McCrindle, I cover the west end of Central Alberta, so out to Rocky Mountain House, Sunchild, O'Cheese, up to Drayton Valley, down to Didsbury, Sylvan Lake. It's a pretty big zone, and then Jen McCrindle covers Stettler, Coronation, Consort, down to Drumheller. And we work to bring as much Turning Point services and programs out to rural and remote communities as possible. We connect with individuals on an individual basis, or we also work to build community capacity in the communities we work in. So things like setting up satellite sites or access points for people to access supplies within their local community. We go out and do presentations, education sessions, whatever we're invited out to do, we'll come out there and do it. Our night reach program is staffed by 2 outreach workers who walk the downtown streets of Red Deer and the Parks and Trail System's 365 evenings per year. They're known by the Red Backpacks. There's a great short clip documentary made about Night Reach on YouTube. If you just type in Night Reach United Way, that video will come up, and it's quite impactful, 5-minute short documentary on what Night Reach does. But those two outreach workers are out there connecting people to health and social services, walking people to the shelters, doing first aid and wound care, providing first aid supplies and harm reduction supplies. I'll bounce back up to health promotion, and that program is staffed by myself, and that's works with people who are living with HIV, hepatitis C, and other STDs. Stay connected to healthcare. And if somebody starts to fall out of staying connected to healthcare, then I can work with them and find out which barriers are keep preventing them from staying connected. So a lot of times I'm seeing things like poverty, instability, food instability, housing instability. Those are the kind of things that keep people from staying connected to healthcare. Overdose prevention is what we're talking about today, or opioid poisoning prevention. That program is staffed by Tricia and myself, and we go out into community and train people how to use naloxone, how to spot an overdose. We talk about current drug trends, what we're seeing, and we usually end off with a naloxone training, which we'll be getting into today. Giving Back is a program in which clients who access Turning Point can come out with 2 outreach workers a couple times per week for 2 hours per session and go out in the community, downtown, in the parks and trail systems, and tidy up needle debris. And then the last program on there is CAMO, Central Alberta Men's Outreach, and that is also things sexual health and overall well-being related for queer, bi, trans, two-spirited men. And yeah, that's a great new program. Please check out our website and learn more. Next slide.
All right, thank you, Kevin. Just a few tips when we're thinking about people who are overdosing. How do we prevent an overdose from happening in the first place? One of the biggest things, and I should qualify that as not to prevent an overdose specifically, but how to prevent it from becoming fatal. Don't use by yourself is really the biggest tip that we can give to you. One of the biggest things surrounding substance use is often the shame and stigma that surrounds substance use and why people often end up using by themselves. So please find somebody safe to use with if that is your plan. If you're using with somebody, stagger your use. So one person uses, wait a little bit, see how that pans out, and if everything's okay, then the other person can use. So those are just a couple of things. Another thing that you can do if you're currently using is, because of the tainted drug supply that's on the street, we don't know always what we're getting. So what might look like the normal dose that you took earlier, you know how you responded to that. The next dose that you take may affect you very differently. So we would recommend always using in small amounts. Use a smaller amount than what you think you would even use. See how it goes. You can always add more. You can't take it away once it's in your system. So that's kind of the thinking behind that. Go small, see how it's going, and then you can top up if need be. Another one is to not mix your drugs. And that's one of the things that's really hard right now because of the tainted drug supply that's on the streets, is not knowing what's mixed in. So what we're finding a lot, as Kevin discussed in the presentation yesterday, the drug supply that's out there, often if people think they're taking what we call down, so an opiate, something that's very strong pain reliever, is sedating, all of that, oftentimes it's now mixed with a benzodiazepine, which is reduces anxiety, causes drowsiness, that sort of thing. So then you have 2 items in your system that are compounding. You're increasing the level of sedation that's happening. So the overdose is actually harder to treat at that point. And it looks very different than what it did prior to the benzodiazepines being added to the supply. So another thing that can happen is speedballing, and that's when somebody adds a stimulant to their opiate. And again, that looks very different. It presents very different when they're responding from the overdose or from the poisoning. So they could become really agitated, flailing, erratic behaviors, that sort of thing. And another way to prevent the overdose from being fatal is to always carry a naloxone kit with you. So that's one of the biggest things that we can recommend. Naloxone kits are free. You can get them from your local pharmacy. You can get them from here at Turning Point. The one thing that I would advise, typically if you're getting from a pharmacy, is that you'll typically only get 1 or 2 kits, and they may have to order them in and they would arrive the next day. If you come to Turning Point, if you need multiple kits, we keep hundreds in stock. So at any point in time, if you need 5 kits, 10 kits, 15 kits, you're more than welcome to take as many as you need. We want them out in the community. We don't want to be storing them here. We need them out in the hands of people who need to be using them. So please feel free to come access them here or go to your pharmacy, whichever you're most comfortable with. We'll go to the next slide. So what does it look like if somebody is overdosing or being poisoned from an opiate? As I mentioned, opiates are very sedating. So ultimately what's happening is the message for our body to breathe is being canceled out or being eliminated. So they might be breathing not at all, or they might be breathing minimally, not enough to sustain good, healthy life. So what that looks like is their chest is not rising and falling with the breath. So when somebody's not breathing, their skin tone turns very pale. You'll see signs of blue-purple coloring around their lips and around their nail beds. Typically then they become unresponsive, so you can call out to them, no response. You can take your knuckles and rub on their sternum or rub between their nose and their upper lip. You can also squeeze their shoulder muscle. If they have minimal to no response to that kind of stimulation, you have a medical crisis on your hands, call 911. Even if you come across somebody and you don't know if it's a poisoning or an overdose, if somebody is unresponsive to that degree, absolutely call 911. It's better to err on the side of caution. With the way things are going right now, you are covered under the Good Samaritan Act to respond as if it is a possible poisoning. So you are safe to go ahead and do the naloxone injection and to respond as if it is an overdose. Other signs that you may see are if they're choking or throwing up, making gurgling sounds. A lot of times what can happen is people misinterpret what sounds like snoring. It's that gurgling sound that's happening in their throat, and it's the body's literal last gasp trying to get air going into their system, and it's not working. So if you hear somebody that, oh, they're just sleeping it off, but you hear a snoring sound, please do check on that person, turn the lights on, check to see that their chest is rising and falling in at least 12 times per minute, and that their skin tone is healthy and pink and not a gray or pale tone to it. And again, that non-responsiveness, if you can't wake them up, call 911 and go ahead and respond as if it's an overdose or poisoning. Next slide. Okay, so this is the part where we're going to learn how to respond to an opiate poisoning, and involves the naloxone training. So Mitch, am I clicking something to get the view going? I'll start the video. Here we go.
Yeah, there you go. And let me just
Let's
get
see
this
how it
out of
works.
the way here. Give me a quick second here to cancel this.
Okay.
There we go.
Awesome. I'm just going to press a button here so I can see what's happening. All right, so hopefully everybody can see me. This is what a naloxone kit looks like. You might also hear it called Narcan. Naloxone and Narcan are absolutely used interchangeably. It is the exact same thing, so don't get caught up in that. So it's a naloxone kit, and I'll show you what is inside of each of the kits. You'll see that there's a pair of gloves. There's a breather mask. In behind here are some alcohol swabs, which you'll likely not ever use. There is a little pamphlet here describing going through this process, exactly what we're training you with. But if you ever want to take it out and read through, just as a reminder, I would recommend that. You can see here that there are 3 vials of naloxone. Each vial is 1 full dose, and there are also 3 new needles. So if you do have to give more than 1 dose, you would use a new needle each time. Okay. So in the scenario where you do come across somebody who is non-responsive, you've called 911, you're waiting for them to get there, you can go ahead and give that first dose of naloxone. So here is your vial of naloxone. You can see it has a white plastic cap on the top. It literally just pops off with your nail. Okay, then you can hopefully see that there's a gray rubber area right in the center there. I'm just going to set that on a flat surface. Here is my needle. On the back end, you can see that there's a colored end here. It actually says feel here. So if you can open a teaspoon, you can peel open this needle. Here is our needle. It's a nice long tip, as you can see on there. It is an intramuscular needle, so it does need to be long enough to go in it right into the muscles where we need it to go. We're also going straight through clothing, so just bear that in mind. So don't panic over the length of the needle. It's got a lot of barriers to access there. So here is the barrel of the needle, of the syringe rather, and this is the plunger, this colored bit at the end. I'm actually going to go and pull down on that plunger. Hopefully you can see the movement here. The black line is at the 1. I actually have 1 ml of air in my syringe. I'm going to grab my vial, poke the needle so that it goes just through that gray rubber membrane. You should still have most of the needle sticking out. I'm going to flip it upside down, thumb on the plunger, push up on the plunger to push that air into the vial. When I take my thumb off the plunger, I'm sure if you can see, it's actually filling up quite nicely on its own because gravity works and the air pressure that we've just put in works as well. I want to make sure I get all of the fluid out, so I'm going to pull down on the plunger. You can see the drips happening there, and now I'm just getting air. I'm getting a nice big air bubble there. Pull the vial off the tip of the needle, thumb on the plunger to push up to get rid of that air bubble. So this is what it's going to look like now. The injection goes into the outer third of the thigh. So that nice big muscle on the front of your thigh, the needle is going to go straight in. So give it a nice firm grip on it, push it into through the clothing, whatever's there. You might want to actually give a quick pat to make sure there's not a wallet or a cell phone there. We want it straight into the muscle, and then we're pushing. Hopefully you heard that click. If you heard the click, you can now see that there's no needle tip sticking out anymore. It's a retractable needle. So once that button has been pushed all the way and you hear the click, the needle actually retracts up into the syringe. You know you've given the full dose then, and it's also a safety feature for yourself. You're going to probably be just tossing this on the ground because the next thing you need to do is give oxygen or give air to this person who is unconscious. So as I said, every kit comes with a breather mask. It's going to come in this little pouch. I'll open it up for you here. It's important to know that this is a one-way valve, so it is very important that you have it facing the right way. If it's facing the wrong way, you're going to be breathing into it and no air is going to be coming into, if I'm the person that's overdosing, I'm not going to be getting any of the effect of the air. If you can read the print that's on here, and this one actually says this side up, you know you've got it facing the right way. So just make sure you've got it facing the right way. So this oval piece will be going into my mouth. So this is where it's really basic first aid kind of principles. So if I'm the one overdosing or being poisoned by the opiate, get me flat on my back on the ground, tip my head back just a little bit to open up my airway. The breather mask will be placed in my mouth. Make sure that you pinch my nose closed. And then in this little round piece here, that's where you will be breathing, and just a nice little puff of air, not a big blowing hard of air. If you're blowing too hard, my stomach will rise and fall. If you keep doing that, I will likely throw up on you. We don't want that to happen. So it's just that little puff of air, enough for the chest to rise, let it deflate to its natural state, give another puff. So it's going to be about 5 to 6 seconds in between breaths. It does take 2 to 5 minutes for naloxone to start working. So if you are by yourself and you've already made the phone call, you're waiting for the ambulance to get there, at that 1 minute mark, so you've been breathing for 1 minute, allow yourself enough time to draw up the next dose of naloxone. At the 2 minute mark, you've got your dosage already. If the person's coloring is not better and they're not breathing independently, go ahead and give another dose. At this point, I would caution that we don't necessarily need the person to be able to be talking, to be very alert. A lot of times they're not going to be now because of the benzodiazepine effects, that sedation that's happening there. So oftentimes they'll be breathing again and their skin tone is good, but they're not able to have a conversation with you, and that's okay. We just need to make sure that they're breathing. And if they're breathing enough, then their skin tone will be good. We want to make sure that we don't oversaturate a muscle. So there could be a situation where they need 2 doses, 5 doses, 7 doses. What I would recommend is doing a couple of doses in one leg. If they're still not alert or still not awake or breathing independently, switch to the other leg. Still nothing, not the normal breathing that we need to have. Move up to the arms. If you're using the arm, it's where the bone sticks out the furthest in the shoulder, about 3 fingers down. So in that meaty part of your upper arm, like where you'd get a vaccine or a flu shot, and it's that straight in movement, push till you hear the click, good to go, start breathing again. If there's more than one person responding, you can have one person breathing the entire time and the other person being in charge of the timer, talking on the phone to the 911 operator, and preparing that next dose of naloxone and giving it again at that 2-minute mark. One thing I would caution is that there is an expiry date on the naloxone. It's about 2 years from the time we give it out. If all you have is an expired kit, go ahead and use it. It's not that it becomes bad at the expiry date, it just starts to lose its effectiveness. I would still rather use something that's 90% effective than to not use anything and have it end very poorly. So expired doesn't mean that it's bad, it just means that it's starting to lose its effect. It is absolutely safe to use on anybody. It doesn't matter if they are pregnant, if they have a heart condition, liver issues, anything like that. Naloxone is absolutely safe to use, so please don't hesitate to go ahead and use it. As I mentioned earlier, you are covered under the Good Samaritan Act to use it. So similar to when you're using first aid response, if you're giving chest compressions, you break a rib, something like that, you are not liable for any kind of repercussions. With respect to the law, it's the same with naloxones. You're free to carry it, free to use it. If anybody complains that you've used it, again, you are covered because you've been trained in it. And it is a safe medication to use as far as first aid response goes. I'm always used to asking questions at this point, so I'm not sure if anybody has any questions to jump in with. One thing, if we can switch back to the video just for a quick second, I will show you that there is a nasal spray version of it. We don't carry this in the office. It's about $150 to $200 for this one dose. However, if you are First Nations or Inuit, you can get it from the pharmacy for free. It is covered under their healthcare plan. So please take advantage of that if you're able to. For those of you who are very terrified of needles, and I understand that that's a very real thing for some people, it might be worth the investment for you to carry something like this, to invest in something like this and carry it with you, just in case you are ever needing to. I see a question here, what happens if you hit the bone? Yeah, that's absolutely fine. Sometimes intramuscular injections do hit a bone. You can pull it out a little bit, angle it differently, and just go ahead and push the fluid in. It's not abnormal to hit a bone. That being said, we've never had that experience here, but I know it's absolutely possible anytime you're doing an IM injection. I would also caution to that we are only using the outer third of the thigh and the arms. We are not using the back end, where a lot of people talk about the butt muscle. We don't recommend using that because of the sciatic nerve that runs down there. We don't want to risk causing any injury to somebody by using that route. So I do not recommend using that. And also, again, going right through clothing, unless it's a sleeve that you can lift up, then by all means do that. But as far as removing somebody's pants or pulling down shorts or anything like that, we are not doing that. It is absolutely safe to go right through the clothing. It's what we recommend, it's what we teach, and it's based on AHS teaching as well. So just to bear that in mind.
So both Tricia and I, as well as all of our staff here at Turning Point, respond to overdoses on site from time to time. And some of the responses to someone receiving naloxone that we've seen, one, I've lost count of how many overdoses I've responded to, but the one I have not seen seems to be the most popular one I'm asked about is, oh, do you get people coming out of the poisoning swinging or angry, like trying to swing at us? And I've never had that experience, and maybe that's happened in the hospital setting where someone wakes up in the hospital, but I have never seen that happen here. Some of the typical ones are crying afterwards. Some people just like to take some time in quiet and go sit by themselves. Others will connect with staff afterwards and get some water, get some food back into their system. And there's also a whole wide array of responses. Some people are very thankful and thank us for responding to the overdose or poisoning. And then others, there is some anger, and understandably so, because what can happen when administering naloxone is for somebody who's opioid dependent, that can put them into withdrawal symptoms or acute withdrawal. And so just keeping in mind that that person had used their substance of choice and then was expecting to get a certain result. And usually it's just to get rid of the withdrawal symptoms and to take away the dope sickness. And then when naloxone's administered, they come out of the overdose and come into withdrawal symptoms right away. So there might be a little bit of anger. Some people have gotten up and just walk away. And in that case, we will follow behind them, toss a naloxone kit with one of their friends, just to make sure someone's monitoring them for an hour after naloxone is administered, because it can start to wear off after 30 to 45 minutes. So if there's more opioids in that person's system, then they'll kind of be hanging outside the receptor site. And then as soon as naloxone starts to pull off the receptor site in the brain, then those opioids, if they're still in their system, can slip back on and cause another overdose. So sometimes we'll throw naloxone kit at somebody and just say, here, take this with you if they want to get up and rush and get out of there. It's quite common that people refuse to go in the ambulance afterwards if 911's called. Again, we'll just make sure the people have naloxone or a friend close by to watch them over the next hour. And then a story that I can share from a rural community is that an individual had overdosed multiple times, and it was shared with me that that person feels like a piece of them was left behind at every single overdose, and they're feeling less and less like themselves every single time this happens. So just keeping that in mind. And then another thing that's happened is someone comes to and is responsive again, and we talk about what happened, and they say, I could see everything that was happening. I heard everything that was happening. Thank you for saying what you said. And yes. And then some people just completely wake up and are in denial that they had stopped breathing at all, and say, the response is, no, I'm completely fine. I was fine. Why did you give me naloxone? I was doing just fine. And then we have to proceed to say, well, you were blue and not breathing, and just remind them of the medical crisis they were in. So I hope that covers the potential responses to naloxone dosing. That's all I have.
I would also mention that there is a program that started a few months ago called NORS, and it's for those who are using substances but don't have anybody to be with them or anybody that they can be in contact with while they're using their substance. It's a phone number that they can call, and it's somebody who stays on the line with them while they're using their substance. If things don't go well and the person becomes unresponsive, the person on the other end will contact emergency services for that person. So there's never a reason why somebody has to be absolutely alone without anybody to respond. So we would absolutely recommend using that program as well if you don't have somebody to use with.
And I'll just mention NORS stands for National Overdose Response Service.